Nina is a 5-year-old Staffordshire Bull Terrier female that broke her right front leg when she jumped off a second-story balcony and landed on a pot. The fracture was so bad that amputation was recommended, but specialist veterinary surgeons put the pieces together and stabilized the fracture using an external fixator. That was February, and therapy began 2 weeks post-op, focusing on alleviating compensatory tension and pain, as well as preventing tendon contracture. In April, the external fixator was removed and hydrotherapy began. We started in the underwater treadmill because it provides better management of a dog's movements, but our aim was to swim and build muscle around the shoulder girdle. In the early phases, there was very little movement in the right front leg following weeks of disuse. In May, Nina developed an infection in the bone. In the X-ray photographs, you can see all the fuzziness around the elbow joint. This is a painful condition, and hydrotherapy was put on hold. After a few weeks and intensive intravenous antibiotics, we received the all clear, and Nina was placed in the pool, but with good management in the water so that she could not injure the leg. The movement in the right front is improving.
Look at you!
In June 2016, she walked. That was the sign to move her back into the underwater treadmill, but this time for walking and gait training. We physically placed her leg while simultaneously pushing her over onto the right front leg to encourage weight bearing. And in this stage, the water supports the leg. As we progress through the video, look at the improvement of her stride and the skips decrease in frequency in the right front leg. Luckily, Nina was not afraid of water. In fact, she really liked it. And there she even chases a chicken. In September, Nina is walking close to normal, and she's no longer taking any pain medication. You can notice that the elbow doesn't flex or bend as well as the other side, but she has a leg. This table shows her improvement through the therapy. There was initially a 10 centimeter difference in circumference around the shoulder. This almost reached symmetry at the end of rehabilitation in September. Her joint range of motion improved, but still remained restricted in comparison to the other front leg. Thanks to determined owners, brilliant surgeons and dedicated therapists, Nina kept her leg and still enjoys mobility and quality of life.